This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning. This is Heiko from Acupuncture On Air. Every Tuesday I talk to different acupuncturists from around New Zealand about all the different styles and the methods and different conditions that it can treat. Today we're going to be talking with Andrew Fraser. Now he's an acupuncturist working in two locations, one in Auckland and one in Hamilton. Good morning, Andrew. How are you?
I'm very well, thanks, Heiko. Hiya gozaimasu.
Now, where are you today? Which clinic are you?
Up in Auckland today. And
Auckland?
It's raining.
Oh, I was just going to say, it must be raining there.
Yeah, no, it's a nice day to be inside.
Yeah. No, I've been doing the radio show now for quite some years, and I've mentioned there are many different styles of acupuncture and treatment methods and how you can apply different theories. And I have mentioned Japanese acupuncture a number of times over the shows, in particular what's probably more known as traditional classical Japanese acupuncture. And you actually, there's a handful of practitioners in New Zealand specialising in this, and you're one of them. So, Andrew, maybe you could just, before we get a bit of information about it, just tell us a bit about yourself first. Like, how did you get into acupuncture? What made you, when did you see the light and you had to go out and study it?
Yep, sure. I won't bore you with too many of the details, but essentially, I was living in Australia and really into Tai Chi and would have quite happily been a Tai Chi teacher, but thought that might be a difficult path and looked at other options. I studied naturopathy for a while, but eventually just found myself in the library reading about particularly herbal medicine and acupuncture. So I think around 2001 I swapped over and started studying.
And you did that in Australia? The study?
Yeah, that was up in northern New South Wales. So I went up to the Gold Coast, 2001, and studied up there. And I was lucky enough that the course that was being run had several teachers that were very involved in Japanese acupuncture. So right from basically the start of my studies, I started to get into the Japanese side of things.
Now, I understand that, since then you've actually been back to Japan a number of times to study again with a master they call Ikeda Sensei. Yeah,
so back when I started studying, he used to come out and do seminars in Australia. He probably had been doing it for about 5 years. And one of my teachers was one of his students, so I was very lucky to sort of bump into him, and we clicked really, really well. And so, he came out. I went to some seminars in Australia first with him and got familiar with what he was teaching. And, I've been to Japan 8 times, probably seen Sensei about 7 of those 8 times, but down to his clinic about 5 times.
Right.
Which is in the southern part of Japan in an island called Shikoku. And, he's a master. He's written over 30 books on classical acupuncture and herbal medicine. His standards are very high, and after, probably 15 years of practice, I feel like I'm just starting to scratch the surface of what he...
You feel like you've just left college.
Yeah, pretty much, yeah.
Now, there's quite a few differences between, like, say, what I would call the modern, Chinese hospital-type acupuncture and classical Japanese acupuncture. Could you? But before you tell us a little bit about the differences, could you first tell us about why in Japan it was originally just reserved for blind people in Japan?
Basically, about 30% of acupuncturists in Japan, I would say, are blind.
Right.
In Japan, they like everybody to...
Our producer here is shaking his head.
I would say some of the top acupuncturists in the world are blind. Right. They have extra sensory perception through their touch, which they utilise in the acupuncture. And, in Japan they don't like people to not be working, so blind people are typically given the options of learning music or acupuncture, the 2 main options. And Yeah, so they're a big part of the society. There's a society called the Toyohari Society, which is basically similar to a little bit similar to what I do.
Yep.
And they're predominantly blind acupuncturists and teachers. They like to gather in groups and practice, and their sensitivity is phenomenal.
Yeah, right. Now tell us a bit about the different needle methods or styles, if you like, when you're comparing, what I'd call like modern day Chinese style acupuncture to the more classical Japanese acupuncture.
Generally, I would suggest that most Chinese hospital type of acupuncture uses the one type of needle, which is a filiform style needle.
Mm-hmm.
Classically, there's 9 needle types. Many of them weren't used for piercing the skin. They were used for rubbing the skin or manipulating the meridians in some way. Some were used for, bloodletting and other things like that, which is part of Chinese acupuncture as well. Japanese is typically known for it as being a very light style of acupuncture. That's not necessarily true, but that is quite common.
Yep.
With the use of very thin needles. So if a patient is sensitive to pain or we're all sensitive to pain, Japanese acupuncture can be applied very, I would say, painlessly.
Yeah.
Compared to Chinese acupuncture, they can be very, very gentle. So it's ideal for older people, for children, babies. So we try to keep it painless, basically, I would say, as a general concept of Japanese acupuncture.
Now, what about the diagnosis in terms of, we're talking traditional classical diagnosis, whether it's Chinese diagnosis or classical Japanese diagnosis. I do know that the Japanese style acupuncture can involve a lot of even just feeling the abdomen. Can you tell us a bit about that?
I can. Diagnostics, abdominal diagnosis came from a tradition of herbal medicine in Japan, which is called Kampo. That is applied in what we do, so we can look at the abdomen and through different, signs, we can make a diagnosis there. But we like to confirm through the pulse. We sometimes use the tongue, but I would say pulse diagnosis is the predominating subtlety of Japanese acupuncture. We're very much into examining the intricacies of the pulse, but that can be easily confirmed through the abdominal diagnosis through many other types that we use as well.
Now, again, on this show of these, I've mentioned the word Moxa many times, which is sort of, the burning of a herb mugwort, where it's somewhat like an incense or a cigar, holding it near points. But tell us a bit about the Japanese style Moxa, because I know Japanese classical practitioners use a lot of Moxa in their clinic. Yeah,
there's several ways that we use Moxa. Traditionally, in Japan, actually, there's 2 licenses when you graduate. You can have a license for acupuncture and also get a license for moxibustion. So there are actually 2 branches of treatment. Traditionally in Japan, moxibustion was very much used by traditional type healers, monks, for example, in the temples.
Yep.
They developed a fine grade of Moxa we call it gold Moxa, which can be applied directly on the skin with a very minimal burning. And
it doesn't actually burn the skin or anything per se, but you
can say it's a very, very minimal burning of the skin. What it does when the skin heats up to a certain temperature is that it invokes an immune response in the body, so it increases white and red blood cell count. So these traditional practitioners, they found all this extra information, extra points of the body that could be used. You could say it's a whole other branch of what we do as well. We also use other types of application of Moxa that are typically used in Chinese style acupuncture. Large cone moxibustion, which is used to disperse the what we call the yang qi of the body and allow heat to escape. So we can actually use Moxa to cool the body, believe it or not, even though it's a heating technique. It depends on how you apply it.
Now, in your clinics now in Hamilton and Auckland, I mean, how are you getting most of your referrals? Are people coming to you from the doctor or the physio, or is it just patients have heard about you? Or
Yeah, I've been around for a little while, so mainly word of mouth. I've got quite a lot of networks.
And are you seeing any specific type of conditions, or is it one and everything?
There's one, and you always get something new. Like I just had a patient ring up today wanting treatment for variceles, and that's something that I haven't treated before. So even after treating people for 15 years, I'm still getting new cases and new ideas to work on. But I treat all over, like obviously I treat ACC and physical type injuries, but do a lot of women's treatments, a lot around fertility and pregnancy. It's quite a wide variety of
And when a patient comes to you, how long are they normally, with you in the room or on the bed, or how long is the session?
I like to try and spend an hour with a patient, approximately, sometimes a little bit shorter.
Yeah.
Acupuncture, I believe, is an art. I think acupuncture is powerful enough that you can stick some needles in someone, walk away and leave them, and they may get some healing response. That can be enough.
Yeah.
But I think we can do a whole lot more with acupuncture than is often maybe done by some practitioners.
Yeah.
And it does require a little bit more time with the patient.
Yeah,
so
a bit more hands-on
it is very hands-on
work.
what I do.
Yeah.
So I don't see 6 people in an hour, for example. I see one person maybe in an hour.
Yeah.
And I'd like to really get a very clear diagnosis and then a very precise treatment of a pattern of treatment.
Good.
And that way we can try to optimise the result that we get.
Now, I think we're running a little bit short of time here. We need to sort of to finish up. But if you could just quickly tell us a phone number for if people need to contact you. Can you give us that?
Yeah, sure. My mobile is 0210 729 531.
Good.
And my email is ajfraser, that's Fraser with an S, ajfraser108@gmail.com.
And I will put those up on the comment section in the YouTube when that gets up, so if people want it, with a link to your website as well. And I've found an appropriate song that we can finish off the show with, and it's a song by the Vapors, and even Ken, the producer here, he's given me the thumbs up for the song because he normally doesn't like my choice of songs. And the song is called I Think I'm Turning Japanese. So here it is.
Good.
Thanks for coming on the show, Andrew.
Thanks, Heiko. See you later.
This program was produced by and first broadcast on Radio Kidnappers, a community access media station. Thanks to New Zealand On Air for making this type of programming possible.